We're going to cover what to do when you throw out your back. At least we're going to cover like the first section of the day, because usually the first part of the day is the hardest. We are locally world famous chiropractors. What's that sound like again?
Locally world famous.
Don made up a jingle. And so locally world famous means that if you're local, you might have know us, but if you're in Kentucky, you probably won't, but you do now. The first part of the day, everyone's laying in bed. Do you want to go ahead and lie in bed? All right, so now the first thing we should probably cover is how did you sleep, number one?
I'm all over the place.
All over. So she's having pain when she's in bed. I'm going to go grab a towel to show you maybe a better way to make this happen, because people won't throw their back out at night. They'll get into bed and they'll struggle throughout the night. So we'll find a towel first.
Perfect. Yeah, most of the time people mention it's the first thing they wake up in the morning is when they feel their back pain. It's getting out of bed. It's those first few steps in the morning. So that's kind of what we're going to go through right now.
Yeah, and just to let you guys know, if that's what you're dealing with, I mean, it probably is, you're watching the video, it gets better. Like there's about a 3-5 day period where it's just angry, you know. It progressively gets better if you don't piss it off. And that's why we're going to show you how to not piss it off and just let the healing happen. But most people can return back to 100% normal. It just takes baby steps. This is step one. Don't piss it off, step one. So we're going to place this under your back. Okay. Notice that I folded this thing just twice long ways. And it doesn't seem like it's doing much. But if you've had back pain before and if you tried this, you're like, oh my God, it feels like it hugs me at night. And so the cool thing about having it long ways is whichever direction you roll, you're still on it. Okay? It's nice to only stay on your back when you have some back pain. I actually prefer legs straight, or or there's like, say you get a big pillow here and you just let it kind of like relax. There you go. And so you just let it relax, and a lot of times if there's leg pain on this side, that'll help out with settling everything too. So that's one. So now she's going to wake up and she's going to open her eyes and think, that's not bad.
It hurts.
So,
the first yawn in the morning always gets you.
Does it?
Yeah.
Oh, I never had that, but I had it with turning over. And so first, because we got to get Dawn to do a little bit of exercise before she gets out of bed, don't wake anyone up. But go ahead and I want you to stiffen up and try to use your arms and legs to turn. And so while we're going to do that, I'm going to have you use your heel to push obviously this table's small. Stiffen up to push yourself over. Good. And now just imagine the table that's bigger and slide this way for me. We're going to get you onto your side first. So push, 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 push. Go ahead and reach, reach, reach. Notice she has her hands and her knee and her shoulder, her hip and her shoulder in the same plane. There's no twisting going on. Okay? That's the key, is don't twist. And so go ahead and use that same strategy to get onto your belly.
If it's a bigger bed, it would make sense.
Yeah, it would make sense in a bigger bed. Okay, so now that she's on her belly, go ahead and put your hands around your forehead and just relax and breathe, okay? The challenging thing in the morning is that there's about an hour window where it just not go well. And so just breathe it out. We're going to see if we can kind of milk the disc out a little bit, or milk the back out a little bit, just to settle it and make it so it's not as bad. Once you feel good in this position, can you go onto your elbows and read your phone? You have some text messages this morning. What do they say?
Sebastian's mean.
Sebastian is awesome. What else does it say? Did I text you that, or I'm sure somebody else did?
People are talking shit.
People are talking shit about me? That's not cool.
It's like, I don't know if I can cuss on this video.
Yeah, probably. So she's just going to hang here for about a minute or so and go ahead and go on your hands again. And then relax again for about a minute, and then go up on your elbows again. And this is kind of it. This is a good spot to be at before she gets out of bed. And now I'll teach you how to get out of bed, and you can take part of the rest, okay? So now we're going to use your body to stiffen and roll, kind of slide that right arm through and get onto your side again, and we're going to creep to the edge of the bed. Good. Now creep, 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 creep. See if you can get it so your knees are just hanging off the edge of the bed right there. She got the struggle face on, huh?
I was trying to stiffen, make sure that everything was stiff.
So you might wonder how you stiffen too. Don't let me hit you. That works, okay? So here's what we're going to do. The key is keeping these two together and not bending as you go up. So Dawn's going to use her left hand, and she's going to swing. She's going to push and swing together. Good, until you get to your right elbow, and then you use both to push and swing. The next trick is getting up off the table or off the bed So creep off to the edge, creep, 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 creep. Put your feet all the way on the ground. I'm gonna grab this camera. Oh, it's not on follow focus. Here we go. All feet all the way on the ground, and can you just stand and put your head through the ceiling? There you go. Now, you've won the day. You beat the day. So
Getting out of bed.
Getting out of bed is the hardest thing. Okay, so now I'm going to hand it over to you. Dawn, I'm now out of bed.
Okay.
How do I beat the day?
So I think as the day goes on, sometimes you'll tend to notice that it starts to feel better with movement, as long as you're not sitting static or anything of that sort. So once you get yourself up out of bed, just walk around. Movement and walking can be really, really helpful. But the next thing is going from seating to standing is always really, really hard for people when they just throw out their back, and any of that sort of hinging movement or sitting down or getting from a standing position is really, really hard for people.
I'll get a chair so we can demo that.
Cool. Yeah, so we're going to go through how to safely, number one, so you don't keep aggravating this area, and how to do it properly going forward from here. Maybe you help reduce the pain while you're doing those movements. So what I'm going to have Seb do, before he even sits down, he's going to bring the backs of his knees to the front of the chair there, just like so. So it's touching like this. And then from here, what I want you to do is arms out. Yeah, so see how he just initially just went rounded to sit down. That can usually really, really aggravate your back. So what I'm going to have him do instead is pretend like he's going to wipe his butt on the back of the chair there. Reach, 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 and sit up just like that. That puts you in a nice stacked position. You can stiffen the belly while you're getting into that as well, and that should really help. Yeah, so getting up out of it is a whole other issue as well. So what I'm going to have you do then is come forward on the chair just a little bit. Perfect. Plant your feet. Good. Drive through your heels and stand tall. Just like that. So it's kind of a robotic movement for the time being, but when your low back has really acted up, it's things like stiffening and really thinking about your movement while you're going through things that can really help heal over time.
Another thing you can do too with another version of getting up is, we call it, so it's a split stance. I know I'm a little bit out of camera angle, but you can see my back foot. It's under the chair. That's probably okay. You're going to play with that camera. It should be on follow focus, so you just kind of tilt it down. There you go. Okay, we're good right there. You can't see, huh? Perfect right there. Okay, so all we're going to do is just lean in here and then just use both feet to push tall. A lot of times this strategy will work for people. We can go put that down. Yeah, perfect. Okay. It hurts to put on shoes too for people, and so putting your shoe on a chair is nice because it limits how much the back moves. It's just me talking. You're not even on camera.
I'm all like, I really like it. I like what you're getting at right now.
Yeah. She was like, yeah. Cool, I like that.
I was like,
but yeah, that's like putting on the shoes is the next thing. Getting in a car. How would they get into a car? Maybe what's an easy strategy?
I think when you're getting into the car, the hardest thing is just that twisting motion of like getting in like this and all that stuff. So I would have them sit first, knees outside the door, and then just stiffen and bring both in at the same time.
Okay, I think that's good. Probably a talking point on this. I saw this video one time. I wish I could find it. It was this guy who was kind of making fun of what we're talking about with a stiff back. And so he's like, don't move your back. And so he's like doing stuff like this and kind of showing how ridiculous it is to not move your back. I would agree with it, but it's all in context. Currently, for about 3 days, you don't want to round your back in most cases when you throw it out because it pisses it off. But it's good practice to bring it back in because rounding the spine is a natural thing. But in this instance, we just have to make sure we're doing things that chill it down, make it feel good, and then you step in after the first aid or the recovery has happened when you kind of are in the stage of I'm just kind of afraid to move or it might come back type of thing. But this is easy remedies for the morning.
Yeah, absolutely. This is just the start, always just the beginning. It would be way too long to make a video on everything that would help with this. But if you guys are at this position, you want some help in how to deal with this, we are located in Huntington Beach, California. You can come see us in office if you are near. If you are far, we have virtual and online options as well. Tons of other things too. Next step after this, if it's been 3 days since you've seen this video and you want to know what's the next step, you can just go on, subscribe to our channel, type in low back stuff, and we got tons of videos and things that you can look at and try to piece together yourself. If you just want some better guidance, just shoot us an email at info@p2sportscare.com, and we'd love to chat with you and brainstorm on what the next step is for you.
And some interesting videos you guys might want to watch is we made one on do you need back surgery most of the time?
We did one like that?
Yeah.
I don't even remember.
It was last
We've done
time.
so many at this point.
So so actually I'll ask you.
Oh.
Oh, by the way, you can go to the channel and search it for the full thing, but short answer, do most people need back surgery?
No.
Do most people need back injections?
No.
Do most people need back medication?
No.
Okay. So now that you have the short answer, go find the long answer, but we can certainly help you through this remedy without a hitch. This is our specialty. So subscribe, like, and share. We encourage you to tell us what dog Dawn looks like other than the Irish setter. See you next time.
I keep forgetting about that.